I gave you guys a heads up on how doctors want to put us on statin drugs to treat cholesterol. I got a lot of questions about the kind of cholesterol tests that I do on my patients. Now, the routine lipid panel that most doctors order has on it the total cholesterol. That's the one that they say the normal level should be below 200. Now, it also has the LDL cholesterol, in which the normal level is said to be less than 130. Now, these numbers have limited value for identifying your true risk. The triglyceride level and the HDL cholesterol are also on the standard test, and these two are more indicative of high risk for coronary disease. Now, my cholesterol is over 200, and I'm not concerned at all because I know the rest of the story. Now, there can be an issue when the total cholesterol is very high. In this case, there could be a condition called familial hypercholesterolemia. That affects about 1 in every 500 people, so it's not likely to be your problem. Now, in this condition, the cholesterol is usually over 300, and there's usually a family history of sudden death from heart attacks, and usually at a very young age, like in the 20s, 30s, or 40s. So barring this condition, I disregard the total cholesterol and the LDL cholesterol. Now, the lipid test I do is called the VAPP. That's VAPP, and it stands for Vertical Auto Profile. It's a test done by a lab in Birmingham, Alabama, and it has everything in it that the standard lipid panel has, plus a lot more. It can be ordered by your doctor from most of the commercial labs in this country. The reason I like it is that it gives you and your physician a better idea of your real health risks and what your optimal preventive measures or treatment strategies might be. The regular lipid panel is a very poor substitute. So what are the numbers the VAPP gives you that the normal lipid profile doesn't? First is the particle size. Now, LDLs, these are the so-called bad cholesterol. Now, they aren't really bad. In fact, we could not live without them. But these LDLs come in large and small particle sizes. Now, the dominance of the small ones is called pattern B, and this is much riskier. Now, you can enlarge them through eating healthier fats and consuming less sugar and starch, as well as exercising and losing weight. So if I have a patient with pattern B, that's that small LDLs, then we know where we want to take their diet: lower carbohydrates and more healthy fats. The other particle size that's important for heart risk is the HDL size. Now, this is the so-called good cholesterol. The large HDL is called HDL2, and lower levels raise your heart risk. Now, we raise HDL2 by fitness, weight loss, and consuming healthy fats. Now, an example would be eating natural saturated fats like coconut oil and monosaturated fats like olive oil. B vitamins like niacin can also raise the HDL2 level. The next item on the VAPP test is the Lp(a) cholesterol. Now, when this is elevated, it seems to be a plaque magnet. It elevates coronary disease risk by 4 times over someone having a low level. Now, possible interventions for a high Lp(a) level are improving the sex hormone levels, increasing natural saturated fats in the diet. The B vitamin niacin again can sometimes raise or lower the level of Lp(a). Now, other interventions that you might consider if this is a big problem, like if you have a really high number, are curcumin, fish oil, vitamin C, and the enzyme lubrikinase. Boluki is a brand name that is best studied. Now, this is an enzyme that's extracted from the earthworm, and it reduces fibrin, which is related to forming blood clots. So you can see the VAPP test is critical for any person that has elevated risk for coronary disease, and that would be those with a strong family history, diabetes, high blood pressure, obesity, high cholesterol or high triglycerides, or if you had an abnormal reading on any test of artery plaque or artery dysfunction. Just placing a patient on a statin drug without knowing the VAPP numbers is bad medicine. Now you need to know that heart attacks and strokes are still a major cause of premature death. And did you know that many times the very first symptom that tips you off that you have a problem is, get this, sudden death. In this scenario, there's no second chance. Share this life-saving information by forwarding this video to a friend. This is Dr. Gerhauser. Thanks for watching.